The long-held interpretation by the Supreme Court that the Second Amendment gives militias, not individuals, the constitutional right to bear arms got a jolt last week when the Bush administration urged the court to rule otherwise. It reiterated Attorney General Ashcroft's unequivocal belief in an individual's right to own guns. But to a majority of American doctors, guns have become more than a constitutional argument. They've become a health issue. A growing number of them are no longer just asking patients if they smoke or drink or about diet and exercise. They're asking if there's a gun in the house. Guns, they believe, are hazardous to our health.
Where's respiratory?
They say they know they're on the front line,
You got a collar?
dealing every day with the damage guns inflict. Each year they try to save the lives of the 90,000 people who are shot. 60,000 survive, some of them damaged for life. Another 30,000, including 4,000 children and teenagers, die.
Okay, give it right away.
Guns were treated simply as a fact of American society, but now doctors are beginning to see them as a national health issue.
So how are you today?
Doctors like Danielle LaRocque, Chief of General Pediatrics at Mount Sinai Hospital in New York City. In routine checkups, she routinely asks,
Do you have window guards at home?
Yes.
Smoke detector?
Yes.
but she doesn't stop there.
Now, the other thing that I like to discuss in homes is whether or not you have a gun in the home. Okay, great.
12 medical associations representing more than 300,000 doctors across the country have formed a coalition urging doctors to treat guns as a health issue, to ask patients about guns. The coalition met last spring to plot strategy.
We need to be forceful with the argument that we are not invading patients' privacy.
The group was founded by Dr. Jeremiah Barandes. He also heads the New York Academy of Medicine.
We ask people how much they smoke, how much they drink. We ask people about sexual practices. We ask people about a lot of things that I think are a good deal more intimate than whether you keep a handgun in the house. Doctors, I think, not only have a legitimate interest in this, I don't see how they can turn away from a cause that produces 30,000 deaths a year.
The doctor asks a patient, do you own a gun? And the answer is yes. What do you propose the doctor say or do?
Counsel them or ask them how securely the guns are stored, inform them a little bit about the risk of having a gun in the home, and the risks are palpable. The risks are not trivial. The risk of suicide with a gun in the home is 5 times as high as if there isn't one. The risk of homicide, the data are a little weaker, but the risk of homicide increases about 3-fold. So it's dangerous.
If you think the National Rifle Association would have plenty to say about all that, you'd be right. But not to us. They referred us to a group called Doctors for Responsible Gun Ownership. It represents only a handful of doctors, about 800. It's run by Dr. Tim Wheeler, a California surgeon. Why shouldn't doctors ask patients if they own a gun, if there's a gun in the house?
It's clear that these physicians are working from a political agenda against gun owners. And therefore, that question becomes inappropriate. Any doctor who asks a patient an intrusive and politically motivated question about guns in the home is committing an ethical boundary violation, and that doctor should be disciplined.
Dr. Wheeler contends that the political motivation of doctors against handgun injury is undeniable because of an article Dr. Barandes wrote a few years ago.
In this article, Dr. Barandes and his colleagues write, and I quote, "Ideally, handguns should be banned completely, but we recognize that this strategy is not currently politically feasible."
Well, I don't think it makes any difference what my personal view is about this. There is a coalition that contains most American physicians that thinks it would be good if less people got killed and injured with handguns, and I think that's an absolutely unexceptionable position, especially for doctors.
Dr. Barandes insists the coalition is not pushing for a handgun ban, that members' views cover the full spectrum. But all do agree that gun ownership is a health issue. The American Academy of Pediatrics, though, does want a complete ban. Dr. LaRocque helped draft its policy statement.
We certainly could take the passive stance of saying, you know, the gun issue is not our issue. We'll wait for children to come to our emergency rooms and to our hospitals, and then we will resuscitate them or we'll try to rehabilitate them. We've learned over the years that prevention is really worth the effort, that we would rather not see children shot.
If a parent says, yes, we do keep a gun in the house, what do you tell them?
I advise the family that I think the gun should be removed from the home, that absence of guns in the home really provide the safest environment for their child.
Well, a gun in the home poses risks, there's no doubt about it. A bathtub in the home poses risks. Matches in the home pose a risk.
You talk about bathtubs and other household items in which clearly the benefits outweigh the risks of having a bathtub. Are you saying the same thing about guns?
Yes, I am. There is actually an enormous benefit to owning firearms, namely that of self-defense.
Dr. Wheeler says research proves that the number of people saved by guns is far greater than lives lost.
There are more than a dozen criminology studies that show anywhere from 600,000 to up to 2.5 million instances each year in which Americans use firearms to defend themselves against violent attack.
2.5 million?
2.5 million.
I've seen those data. I'm not convinced by the data. I'm much more convinced by the data that show that the presence of a gun is a hazard to those in that home.
Each side dismisses the other's statistics
The two
as
sides
worthless.
cancel out. Clearly, the criminologists are the experts when it comes to gun research, not doctors.
Doctors are the experts on treating the misuse of firearms.
Let's be clear. Doctors are experts in treating injury and illness. Doctors are not experts in criminology. Doctors are not experts in the mechanics of firearms and safety mechanisms. And doctors are certainly not experts in gun safety education. They should leave those areas alone and concentrate on what they're supposed to do, which is take care of sick people and try to save lives if possible.
That's what Dr. Mark McKinney does every day.
All right, Dana.
He's a surgeon at the Ryder Trauma Center in Miami, which alone treats about 500 gunshot victims a year.
I've been a trauma surgeon for 10 years, so in that period of time, every gunshot wound you can think of, every location you can think of, I've seen.
Lots of them?
So many that it'd actually be difficult to put a number.
Is there a profile you can draw of a typical victim?
Not that there's not a group that is not at risk.
Dr. McKinney is a gun owner himself, but believes that a family doctor has every right to ask patients about guns. Do you see a gunshot injury and fatalities as a public health problem?
Oh, clearly, and no doubt about it. It's a public health problem as motor vehicle crashes, car accidents, HIV or other diseases. Huge impact on the national health care, and it's clearly a problem of national significance.
Not all of his colleagues agreed. Dr. Honore Opaku, a surgery resident at the Ryder Center, knows about gunshot injury and knows about guns. He used to deal in them. He does not believe they are a public health risk.
An armed society is a better society.
So you're a true believer?
I'm a true believer.
A lot of people are going to find it hard to believe that you, as a surgeon who knows what gun will do, are so adamant on this issue of guns. How come?
I think that what people are really misunderstanding is that the violence that we see is a result of many other factors. The gun is the symptom of the problem, but it's not the problem itself.
You've treated gunshot wounds?
Yes, I have.
Children?
Yes, I have.
And that hasn't made you think again about what you believe?
I had, within a period of 3 days, I had two young kids who both got shot in the chest, a 2-year-old and a 3-year-old.
2-year-old and a 3-year-old?
2-year-old and a 3-year-old. It's heart-wrenching to see that. At the same time, I see far, far more kids who they weren't wearing a seatbelt and get thrown out of a car, kids who get hit by cars. A kid is far more likely to die in a car accident than he is from a gunshot wound.
The federal government decades ago set up a national database that examines all auto fatalities. More than 100 pieces of information are collected from weather conditions to time of day, and filed in one central repository.
That database has resulted in safer highways and safer cars and permissible blood alcohol limits in drivers and seat belts, child restraint systems, and so on. Tens of thousands of lives have been saved.
The Doctors Coalition is calling on the federal government to take the same approach to guns.
It's perfectly plain you cannot intervene intelligently in a public health threat absent adequate information. It just can't be done.
After the Centers for Disease Control, the CDC, began initial work on a database to examine gun deaths, it ran into a brick wall. Pro-gun groups lobbied Congress to cut the CDC's research budget, and Dr. Wheeler was one of those who testified. So why not have the Center for Disease Control, for example, create a database and find out the details of every gun fatality? And surely information would only help everyone. And you oppose that.
Gathering all this information raises an important point. All of our records, including medical records, are becoming computerized now, and there is a great concern among Americans that vital personal information, including about their gun ownership now, might make its way into some government database or huge insurance company database.
The CDC says no gun owners' names would be attached to the data. They now propose a national database that would track all violent deaths, including those involving guns. But such a database would not appease Dr. Wheeler and his group.
Physicians are justified in counseling people on the risks and hazards that we encounter in life. That's part of our job. It is not our job to engage in a political assault on a fundamental right of our patients.
90% of American physicians think this is a public health issue. Dead is dead. That's a clinical matter. And being shot and seriously injured is also a clinical matter. I really don't understand how anybody can argue with the idea that it would be good if there were less of that.